Hi, I'm Dr. Arvin Balachandran. I'm a consultant ENT surgeon and rhinologist from Bukit Tinggi Medical Center in Klang. There are many causes of blocked nose. Firstly, there are these tissues by the side of the nose, they're called turbinates. They're actually shelves of bone surrounded by vascular tissue, and these can be enlarged in patients with allergy or even in infection. And then there is this mucus that can be produced by the sinuses, and that can clog up the nose in sinusitis. Next, there is this polyp that could appear from the nose depending on which sinus that it appears from. So it can be large enough to block the nose. These polyps actually appear from the linings of the sinus, and they can prolapse into the nose and block the nose. There is this deviated septum. Septum is a divider of the nose that can be deviated to either side, and there is a tonsil tissue at the back of our nose. These are called adenoids. These adenoids can be quite big in especially children, and could be due to allergy or recurrent infections. They can be large enough to cause snoring and also blocked nose. Yeah, some causes of blocked nose can be treated by medications. For example, the turbinate enlargement, we can use some decongestants like oxymetazoline, like for instance. You can spray into the nose and can reduce the blood flow to the turbinate, and that will reduce the size of the turbinate. But these are actually temporary measures. Then there are nasal sprays such as steroid nasal sprays, and these can be used on a longer term and is quite safe. Then there are these terima or saline sprays and sinus rinse that can be used to clear up our mucus in the nose, can treat sinusitis. There are other medications like tablets and all that can also be used to reduce flu-like symptoms, and of course antibiotics for infection. Like for instance, the septal deviation is a bony deviation and medications can't treat that. So we have to do a surgery called septoplasty to straighten this bone. Then you have enlarged turbinates, the cushions by the side of our nose. If medications do not reduce or shrink the size of the tissue, then we can trim the tissue. It's a surgery called turbinoplasty. And then for sinusitis and nasal polyps, let's say medications can't treat and it become chronic, then we have to do a sinus surgery. And as for adenoid enlargement, we can do something called adenoidectomy to shave off the adenoids, especially in children. If let's say there are tumors of the nose in adults mainly, we can do endoscopic surgery if it's removable or excisable. Further to that, I assist the neurosurgeon in opening the pathway to the brain. We call a keyhole surgery to the brain for tumors in the brain, and we can operate these tumors through the nose. And I also assist eye surgeons for tear duct obstruction, traditionally done externally via cutting near the eyelid. Now we can do it fully endoscopically. If you have any nasal or sinus issues, or even if you have done a sinus surgery before but still having symptoms, you can always drop by and see me at Bukit Tinggi Medical Center anytime. Just make an appointment, come and see me. I will attend to you. Thank you.